Greetings, dear viewers, and welcome back to the review program. With its rapidly evolving legislative landscape and ambitious reforms, Uzbekistan is working towards a future where every child has access to education, healthcare, and safety. In this episode, we will review the current conditions of children's rights in Uzbekistan and analyze what have been done in this area. With children making up approximately 35% of the country's population, Uzbekistan has a vested interest in investing in the next generation. This demographic composition has prompted the government to focus on protecting and improving the lives of the youngest citizens. However, challenges persist. Now let's analyze the key reforms on children's rights in Uzbekistan. The most transformative development has been the adoption of the law on the rights of the child in 2023. This landmark legislation aims to align Uzbekistan's legal framework with international standards, reinforcing the country's commitment to the UN Convention on the Rights of the Child, ratified by Uzbekistan in 1994. Key elements of the law on the rights of the child include equal access to education and healthcare for all children, irrespective of background, safeguards against violence, exploitation, and discrimination in all forms, strengthened support services for orphans and for children with disabilities. Education remains an essential focus. Uzbekistan's government increased its budget for primary and secondary education by 20% in 2023, marking a significant commitment to improving educational infrastructure, especially in rural areas. This funding supports new schools, enhanced teacher training, and digital learning tools to provide a modern educational experience. Between 2022 and 2024, Uzbekistan made strides in improving children's healthcare, particularly in rural areas. According to the World Health Organization, child mortality rates have dropped by 7% during this period, a notable improvement driven by expanded pediatric services and maternal healthcare programs. The government has also emphasized immunization, achieving 95% vaccination rate against diseases like measles and rubella by 2023. Regular health checkups for school-age children have been introduced, targeting early intervention for common health issues, while nutritional support programs address malnutrition in vulnerable populations. In response to poverty affecting families with children, Uzbekistan has increased child benefit allowances by 15% in 2023. This financial support is aimed at low-income households, helping alleviate economic pressures that might otherwise impact children's welfare. Additionally, a new initiative provides shelter, counseling, and vocational training to street children, integrating them back into society and offering pathway to stable future. Despite notable progress, Uzbekistan faces challenges in fully realizing its vision for children's rights. One of the ways to tackle with these challenges is international collaboration. Uzbekistan's progress in children's rights is partially due to its collaboration with UNICEF, UNDP, and other global organizations. These partnerships bring valuable resources and best practices to Uzbekistan, enhancing program effectiveness. For instance, in October, the representatives of the Senate, UN, UNICEF, and Children's Ombudsman presented a situation analysis of the condition of children and adolescents in Uzbekistan. You may see the details of this event in our following report.
The analysis emphasizes human rights principles such as equality, non-discrimination, and fairness, focusing on creating equitable opportunities and outcomes for all children.
This year, this United Nations Convention is turning 35 years old, so this is an anniversary, and it is the most ratified convention in the history of the United Nations. So this is the reason that I believe that all the countries understand the importance that at the core of this convention is the humanity, and everybody wants children to thrive, so that the boys and girls really have their well-being and get the chances in their life and can develop their talents.
Uzbekistan has made notable progress in providing universal healthcare with significant improvements in access to primary care and service quality. Implementing a national health insurance program under the Uzbekistan 2030 strategy aims to reduce early mortality and increase life expectancy. However, gaps remain. Around 9,000 children are still unvaccinated, and stigma and limited access to preventive services make it difficult for children and adolescents living with HIV to receive care, with only 31% of them accessing antiretroviral therapy. In education, primary school enrollment reached 99% in the 2021-2022 school year. Preschool enrollment grew from under 30% in 2017 to over 73% in 2024, with nearly 2 million children enrolled in 2022-2023. Internet access is now available in 94% of schools, boosting digital learning and ICT access. However, concerns persist about education quality, particularly in basic skills and competencies, and there is still much to be done for inclusive education. Uzbekistan has also made strides in institutional reforms and legal protection for children. For example, the law on protection for children from all forms of violence was approved by the Senate and is waiting for a president's signature. As part of childcare reforms, 23 orphanages have been closed in the past 2 years, with 2,448 children in family care. Despite its protest, 79% of children in institutional care are also with disabilities, indicating the need for more family support and reintegration services.
You know, as child experts, we always see the glass half full. It's never fully full for children. So all countries have very happy about the law on the elimination of all forms of violence against children, which has been passed by the Senate. And we really look forward to the endorsement and the approval from the president of this law, because it will ensure that it's operationalized in all aspects, at school, in the health centers, everywhere, to ensure that children are treated with fairness, with love, that children are heard.
The analysis was developed with the input of government ministries, non-governmental organizations, and people with disabilities, including adults and children. The findings confirm the significant progress Uzbekistan made over the last 5 years and point to areas that need further improvement. For reference, the last analysis was conducted in 2019-2020.
To better analyze the current condition of children in Uzbekistan, government's actions in this area and its future visions, we have talked to the children's ombudsperson Suraya Rahmanova. Good evening, Miss. First, I would like to thank you for dedicating your time for this interview. Let's start off with the overall condition of children's rights in Uzbekistan. What were the most significant changes and drawbacks in this area? In recent years, protection of children's rights has become one of the most important priorities in Uzbekistan's state policy. This area is now central, and as a result, new approaches and working methods have been introduced. An effective legislative foundation and legal mechanisms for implementing adopted laws and programs have been established. Comprehensive measures have been undertaken to ensure and improve children's rights in education, healthcare, social protection, and other areas. For example, Uzbekistan's preschool education coverage has significantly increased, recognized both nationally and globally. In 2017, preschool enrollment was 30%, but due to institutional, organizational, legal, and social efforts, it now exceeds 73%. Primary school enrollment has also reached 99%. These initiatives are supported by government funding, with over 20% of state budget allocated to education, ensuring stable growth in this area. In healthcare, over 50 parental centers have been established across the country to ensure the health of mothers and children, starting from neonatal care. Child labor has been fully eradicated in Uzbekistan, eliminating an obstacle to children's right to education. A significant institutional and legal reform is the establishment of Children's Ombudsman, created with the support of attention of a state leader. The ombudsman appointed by the Oli Majlis operates under a law enacted on March 2nd of this year, focusing on protecting children's rights and restoring any violated rights. These activities are carried out in line with the United Nations Convention on the Rights of the Child, the first international document ratified by independent Uzbekistan in 1992. Our work is directed towards implementing this international document. Now state policy sets new tasks, such as further expanding children's rights across various fields. Earlier, you mentioned education reforms and said that there is a large-scale coverage. How does the government plan to improve the quality of basic skills, especially in rural areas? The situation regarding children's rights to education varies across different regions, which is natural. The conditions in the capital differ from those in remote regions, as is the case in any country. In the capital, there are more resources and access to educational tools. Therefore, within Uzbekistan 2030 strategy, the government has planned measures to ensure full preschool and school coverage for children across Uzbekistan, regardless of region. The strategy also addresses the area of international and communication technologies, particularly in IT. To support this goal, the government will establish IT hubs in 15 remote regions that are far away from the capital and lack adequate educational resources. These hubs will provide services to young people, including adolescents. Each year, over 10,000 young people and teenagers will train in IT skills, foreign languages, and other innovative subjects and professions. This initiative will significantly improve children's access to education. What are the main obstacles to implementing inclusive education, and what steps are being taken to support children with disabilities in schools? Inclusive education is one of the core issues in children's education in Uzbekistan. We have a strategy for the development of inclusive education from 2020 to 2025. Under this strategy, the government plans for more than 50 schools nationwide to offer inclusive education by 2025. This approach aligns with the social guarantees in the Constitution of Uzbekistan, which in Article 50 affirms every child's right to education, including children with special needs. This includes children with various disabilities who hold the same rights as other children. 2 years ago, there were 87 children in inclusive schools. Today, 736 children receive education in general public schools. In current 2024 school year, over 417 schools have inclusive classrooms that meet children's needs. At present, 4 state-run, multi-profile specialized preschool educational institutions operate within the framework of IMKON and UMID. These institutions, located in Nukus City, Kibray district of Tashkent region and Navoy region, serve as a rehabilitation centers providing comprehensive educational services to children with special needs and preparing them for school. A significant achievement in this direction is that many children who complete preschool at the centers continue their education in regular schools, eliminating the need to attend specialized boarding schools. Social acceptance is also crucial. It is essential to remove social norms and stigmas that isolate children with disabilities. Eliminating these stereotypes requires the efforts not only the government but also our society, parents, and the children's close relatives. You mentioned about the orphanages. Over the last 2 years, 23 orphanages have closed, but 79% of the remaining children in orphanages have disabilities. What measures are being taken to reintegrate these children into families and support their relatives? The statistics you noted likely come from UNICEF's situational analysis. The institutionalization process, which started in 2021, led to closure of 23 orphanage-type institutions. These closures included various facilities, such as orphanages, baby homes, and other isolating institutions. Currently, only a few orphanages remain open, specifically serving children with disabilities. When we refer to 79%, it doesn't represent as large a number as it may seem at first glance. It involves only a few specific orphanages where children with disabilities are currently placed. The National Agency for Social Protection leads efforts in this area, coordinating most of the work related to these institutions. Notably, as part of the National Action Plan to implement the UN Convention on Rights of the Child, the agency and other relevant departments are actively implementing specific measures. For example, they include training specialized professionals in child protection sectors to apply standards and tools when working with institutional settings. Additionally, there is ongoing work with family-based children's homes. Many of these children lost parental guardianship or are orphans, and they have now been placed in alternative family-based environments. Essentially, these children have reintegrated into family care. In this setup, Uzbekistan currently has 130 family-based children's homes. These are regular families who have taken in these children and care for them as their own. Through nationwide monitoring, we assess the living conditions and ensure these children's rights are upheld in these family-based settings. We have observed remarkable progress and positive change in the children. Growing up in a nurturing, loving family environment positively impacts their education, well-being and overall development, yielding significant results.
Есть одна тоже еще проблема важная в этой отрасли – это насилие против детей. И моральное, и физическое.
There is an important issue in this field, violence against children, both moral and physical. The incidence of violence is increasing. Also, during the presentation of UNICEF's analysis, you repeatedly mentioned that bullying is planned to be addressed at the legislative level. What can you say about this? You are probably following the legislative developments in this area as well. The Senate of the Oli Majlis has approved a law on protecting children from all forms of violence. We are currently awaiting the President's signing of this law, and I'm confident that soon this law will become a key tool in preventing and combating violence against children. Article 19 of the Convention on the Rights of the Child requires states to take all measures to protect children from all forms of violence, abuse, neglect, and lack of care. In line with implementing this international obligation, the new law on the protection of the children from all forms of violence covers various forms of violence, including physical, psychological, and sexual abuse. The law will now also address forms of violence that were previously unrecognized, such as neglect, lack of care, exploitation, and coercion of children into hazardous labor. Bullying, as you mentioned, will also be covered. Uzbekistan is not acting in this direction solely because of domestic developments. This is a global issue that requires more effective measures, and this law now provides for these forms. We are actively working in this direction. The law will include phased effective measures to prevent bullying in educational institutions. For example, our Secretariat of the Children's Ombudsman received numerous reports from specialists who lack professional knowledge on how to address these issues. Building specialist capacity is currently one of the Children's Ombudsman's most important tasks. What initiatives does the Ombudsman plan to implement in the near future? We have identified several priority areas, including protecting children from all forms of violence, as we discussed, and ensuring that every child's right to be heard is respected. As outlined in the Convention on the Rights of the Child, a child's violence often isn't taken into account in decisions that impact their future, but every child has the right to participate in decisions that directly affect their life, such as their residence, future care arrangements, or education. In all these matters, children have right to be heard. In this regard, we are working with all relevant agencies. The Ombudsman's Office has established a working group to review judicial decisions and case materials that will guide important measures. We are also focused on introducing a unified approach that prioritizes the child's best interest. In various situations, whether social or legal, everyone involved, parents, teachers, social service professionals, and others must act in child's best interest. This involves determining what is the best for the child and creating the most supportive conditions. Unfortunately, this approach is not yet fully established, so we are working closely with specialists to develop it. Another key area we are addressing is ensuring children's access to justice. This includes situations where a child is in a conflict with the law, is a victim of a crime, or is involved in legal or investigative proceedings as a witness. Providing professional, legal, social, and psychological support is crucial. To achieve this, we need to continue building the capacity of specialists and law enforcement personnel. Uzbekistan's approach to children's rights over the past 2 years demonstrates a strong commitment to protecting and empowering the nation's youth. Legislative advances, improved access to education and healthcare, and increased financial support for vulnerable families all indicate Uzbekistan's dedication to a brighter future for its children. Here our analysis ends. Thank you for watching this program and see you in our next episodes.